Pregnancy tests, what they can tell you about your health. Pregnancy tests can be incredibly helpful in understanding a woman's health. This article will discuss the various types of pregnancy tests and what information they can tell you about your health. We'll cover common test types, such as blood tests, urine tests, and ultrasounds, as well as their limitations and what other health conditions they can reveal. Read on to find out more. Introduction to pregnancy tests. Pregnancy tests are an important tool for monitoring the health of pregnant women and their developing babies. There are many different types of pregnancy tests, each with its own advantages and disadvantages. Here is a brief introduction to some of the most common types of pregnancy tests. Urine tests. Urine tests are the most common type of pregnancy test, and they can be performed at home or in a healthcare setting. They work by detecting the presence of human chorionic gonadotropin (HCG) in the urine, which is produced by the placenta during pregnancy. Urine tests can be very accurate, but they are not always able to detect very low levels of HCG, so they may not be suitable for early pregnancy testing. Blood tests. Blood tests are more sensitive than urine tests and can detect lower levels of HCG. They are usually performed in a healthcare setting, but some home test kits are available. Blood tests are generally more expensive than urine tests. Ultrasound. Ultrasound is sometimes used to confirm the results of a positive pregnancy test. It can also provide information about the location of the pregnancy and the number of embryos present. Ultrasound is generally safe and does not pose any risks to the mother or developing baby. Biophysical profile. The biophysical profile is a combination of an ultrasound and a non-stress test. It is sometimes used to assess the health of the fetus when types of pregnancy tests. There are two types of pregnancy tests, the urine pregnancy test and the blood pregnancy test. The urine pregnancy test is the most common type of test. It can be done at home or in a doctor's office. The blood pregnancy test is done in a lab. The urine pregnancy test measures the level of HCG in your urine. HCG is a hormone that is produced by the placenta during pregnancy. The level of HCG in your urine increases as your pregnancy progresses. The blood pregnancy test measures the level of HCG in your blood. This test is more accurate than the urine test, but it is also more expensive. If you think you might be pregnant, you should take a pregnancy test. If the results are positive, you should see a doctor to confirm the results and to start prenatal care. What do pregnancy tests reveal about your health? Pregnancy tests measure the level of human chorionic gonadotropin (HCG) in your blood or urine. HCG is a hormone produced by the placenta during pregnancy. A positive pregnancy test indicates that you are pregnant. A negative pregnancy test means that you are not pregnant. If you get a positive result, you should see your healthcare provider to confirm the results and start prenatal care. Pregnancy tests cannot tell you how far along you are in your pregnancy or if your pregnancy is healthy. Your healthcare provider will perform other tests, like an ultrasound, to check on the health of your pregnancy and determine how far along you are. Pros and cons of taking a pregnancy test. There are many different types of pregnancy tests available on the market today. Some are more accurate than others, but all have their pros and cons. Here is a look at some of the most popular pregnancy tests and their pros and cons. Home pregnancy tests. These are the most popular type of pregnancy test, as they are relatively cheap and easy to use. However, they can be less accurate than other types of tests, particularly if used too early in the pregnancy. Blood tests. Blood tests for pregnancy are usually more accurate than home pregnancy tests, but they are also more expensive and invasive. They can also take longer to get results back from the lab. Ultrasound. An ultrasound is the most accurate way to confirm a pregnancy, but it is also the most expensive and requires a trip to the doctor's office or hospital. Amniocentesis. This is a test that can be performed during pregnancy to check for certain birth defects. It involves inserting a needle into the uterus to collect a sample of amniotic fluid. While it is considered very safe, there is a small risk of miscarriage associated with it. Chorionic villus sampling (CVS). This is another test that can be performed during pregnancy to check for certain birth defects. It involves taking a sample of tissue from the placenta using a long thin needle inserted through the cervix into the how to interpret the results of a pregnancy test. If you've taken a pregnancy test and are wondering what the results mean, this section is for you. Pregnancy tests measure the level of human chorionic gonadotropin (HCG) in your body. HCG is a hormone produced by the placenta during pregnancy. There are two types of pregnancy tests, those done with a urine sample and those done with a blood sample. Urine tests are less accurate than blood tests, but they're also less expensive and easier to do. A positive result on a pregnancy test means that you're pregnant. A negative result means that you're not pregnant. If you get a positive result on a urine test, it's best to confirm it with a blood test. Alternatives to pregnancy tests. There are a few alternatives to pregnancy tests, but they're not as accurate. The most common alternative is the withdrawal method, where you track your cervical mucus. When you see an increase in cervical mucus, it means that ovulation is happening and you're at your most fertile. Another alternative is to track your basal body temperature. This method is a little more difficult because you have to take your temperature every morning before you get out of bed. If there's a rise in temperature, it means that you've probably ovulated. Lastly, you can keep track of your menstrual cycle on a calendar. This isn't as accurate as the other two methods, but it can give you a general idea of when you should expect your period. Conclusion. Pregnancy tests are an important tool for tracking the health of both expecting and non-expecting mothers alike. Not only can they tell you if you're pregnant or not, but they can also provide valuable information about your overall health. By understanding what pregnancy tests can tell you about your body, we can gain insight into our reproductive systems and better understand how to take care of ourselves during a pregnancy journey or beyond. With this knowledge in hand, we can make informed decisions that will help us lead healthier lives for years to come.